I'm Heather Fullerton. I'm a professor of child neurology at UCSF, and I'm the director of the Pediatric Stroke and Cerebrovascular Disease Center at Benioff Children's Hospital. I study childhood stroke, so I study reasons why children will have either an ischemic stroke, which is a blockage of blood flow to the brain, or a hemorrhagic stroke, which is bleeding into the brain. So I study why children have these. They're unusual in children, but they do happen, and the reasons for them are actually very different from stroke in adults. So that's why we do separate studies on stroke in children. Ischemic strokes can happen in children for a variety of reasons. Some children are born with a predisposition to stroke because perhaps they have a structural abnormality of their heart, something we call congenital heart disease. Other children might have sickle cell disease, which can really increase your risk for stroke. And then also previously healthy children can have strokes. And those we've been studying in a variety of ways, but it seems like most children who are previously healthy with a stroke have some sort of disease of a blood vessel to the brain, and we're trying to better understand those. Childhood stroke spans a pretty wide age range. We usually think about childhood stroke as those happening in babies, usually greater than 1 month of age, all the way through adolescence, so up until 18 years of age. The Stroke in the Young project is an NIH-funded project to help us better understand why both children and young adults have strokes. We want to combine those two age groups because in general childhood stroke has been studied separately from stroke in young adults, but we think that there's actually a lot of overlap, and we're actually trying to figure out whether certain risk factors for stroke in adults are now extending into the pediatric age range. So things like high blood pressure, diabetes, being overweight, those are clearly risk factors for stroke in adults, and we want to understand what is the lower limit when those sorts of risk factors play a role. So the Stroke in a Young project is a study that we're doing in the Kaiser population. So there are a whole population of people who are members of Kaiser Permanente, and we're going to study stroke in both the children and the young adults in the Kaiser population. And so we'll start by first identifying those patients who have had strokes in the system, and then look at risk factors for stroke by comparing the children and young adults with stroke to actually healthy control children and young adults that are also in the Kaiser population. I think that understanding risk factors for childhood stroke and also whether certain risk factors that we know to be important in adults are playing a role in childhood will have implications on how those risk factors are managed in young adults and even adolescents. So for instance, if we find that obesity or high lipids is important in childhood stroke, then it means that policies for screening for those disorders should be changed to start the screening at younger ages.